February is Heart Month, and no, not the Valentine, but an effort to put a spotlight on cardiovascular disease. Megan Walls is a nurse practitioner with Aspirus Cardiology. She joins us via Zoom to talk on this disease that impacts so many. Now, Megan, what are the risk factors of heart disease?
One most people think of is coronary disease or blockages within those coronary arteries, but there are other things that can happen as well. And I think, to me, sort of the big three, because we sort of classify them modifiable and non-modifiable risk factors. Which ones can we affect ourselves and which ones are we sort of just stuck with? Those being, genetics, our family history and genetics play a part in things, whether we're male or female play a part in things, how old we are, and even our ethnicity. So those ones we can't really change. But can affect our risk as well. I always sort of call them the big three: high blood pressure, high cholesterol, and smoking history. People know those ones. I think those ones are pretty well known out there. I would say some of the lesser known that we're learning more about exactly how they affect things, and I think that people don't always remember or see, diabetes and prediabetes especially. I think diabetic sometimes is known, prediabetes not as much. Our nutrition, processed food can play a really big part into it. It also plays a part into being people having overweight and obesity, which are also risk factors for coronary artery disease. The amount of physical activity that we get, excessive alcohol consumption, and even stress and sleep.
Do heart attack symptoms look different in women versus men?
We as clinicians sort of classify things as typical or atypical presentation symptoms. I think the ones everybody sort of knows is the chest pain, the tightness, the pressure, the elephant sitting on my chest. I feel like my chest is being hit by a Mack truck kind of descriptions. Those would be the more classic symptoms. But not everybody feels those. They're probably more associated with males feeling those types of things. Women can as well. But there are many other things that people can experience. I've taken care of patients who would come in because they just felt off. Something just didn't feel right. They had this sense that something was wrong. And they find out that they're having a heart attack. So, there can be very subtle things that can happen. Women as well as diabetics tend to have more of the subtle things. And those can be things like suddenly fatigue with things that you wouldn't necessarily be before. Significant changes in your activity tolerance. In terms of pain or discomfort, they'll tend to sometimes feel it more so they can feel it in their neck and into their jaw, even into their back.
What advances in cardiology care are helping patients live longer, healthier lives?
Some of the biggest things we've had in terms of care here at Aspirus is we have more offerings for less invasive methods for valve disease, particularly with the mitral and tricuspid valves for people who have leaky valves. We now can do things a little bit more minimally invasive. We've been doing the mitral valve for a few years and just added the tricuspid valve here recently. So we do have those offerings for the right patients. In terms of heart failure, so patients who have a reduced ejection fraction or weakened heart, we do have capabilities for an implanted device that can help with symptom management. It doesn't necessarily, at this point, shown to improve the strength of the heart, but can help patients symptomatically in terms of quality of life. We've had aortic valve minimally invasive procedures for several years now. And there's been many changes in terms of medications as well.
Thank you for your time this morning, Megan. Stay with us and we'll be right back after the break.